Hi, Dr. Amy. I'm a pediatrician from Kinder. So we've been doing this special series on COVID-19. And for this video, let's talk specifically about how to approach talking to your children about social distancing, about the myths and rumors that might be out there, and how to just engage them in the process to protect everybody and also to decrease our anxiety overall as we deal with this together. So I, along with you, have breathed a collective breath of relief that children are medically, clinically doing okay with COVID-19 and there haven't been too many bad outcomes. But again, on the flip side, I always have to say they are carriers who can be asymptomatic. So I would maybe protect the vulnerable people in your family by distancing them from the children, especially if they show any symptoms at all. But children are still affected by something so dramatic going through our community, affecting every family. So as we all deal with our anxieties and worries, and also learning some of the truths about the COVID-19 pandemic, let's talk about how best to approach talking to kids about this and involving them in the process. So first, I would open the conversation and let them know that you're keeping it open. Kids can be very sensitive to stresses and problems that the family and also the world is going through. So they probably already know something's going on. And being kept in the dark usually makes them more anxious. So this is a good opportunity to come together as a family and talk about something that could be very scary to everybody in different ways. I think a good place to start is to ask them what they know. From teachers, their peers, the media, if they're old enough to access that, they probably already have some idea and they might also be full of questions. So I think it's good to ask them, tell me what you know so far and what questions you might have. And then from there, you can guide them through what you think is correct. Now, before you answer, I would say let's be aware of our emotions and feelings that we're projecting. And it's very common and normal to be nervous about this. But when we communicate with kids, I would try to keep it as factual and direct as possible. And just to be aware of our own nervousness so that we try to project as much calm as we can in this conversation. And in the same way, I would maybe calmly share the fact that you're maybe afraid or worried or concerned with the kids, and hearing them or them hearing you using those words and putting the words to the feelings also opens up the opportunity for them to tell you not only what they think they know, but how they feel about it. So to create that safe space back and forth where they're able to communicate with you as this situation develops, I think would be very helpful for any anxiety that might develop. And then when it comes to actually what to do, kids love to be given a job, something like hand washing, giving them a sense of empowerment that they can do something about this. And I would encourage you the first few times, do it together. Sing the songs together as you wash your hands. Keep it as light and lighthearted as you can. In fact, if you're washing your hands and singing, they're most likely to join in anyway. So in that way, kids can feel like they're part of the solution and they're part of this greater effort in the family, so that maybe it's not just something to be scared of, but something to come together for. And also to show them through example how we can talk about something and learn about something together, even though we're afraid. Ultimately, this has been and still is a big test for our world community. And I think it might affect the way we live and our concepts of health, public health, and many areas of life for a long time. So hopefully our kids will be part of that solution. And ultimately right now, it's about protecting our community as much as possible and doing what we can.